care coordinating team that should do their outreach. We made a change and we said these outreach teams will try and serve as that bridge to get somebody back to their care provider. And folks, for all the programs, need to be a resident or is homeless in counties, except Epic. If somebody presents at one of these onboarded hospitals, regardless of where they reside. And I think that's the synopsis. So everything we're going to try and cover from here forward is saying, I want to refer a client, and for one reason or another, it's not possible that I can refer through these mechanisms. It could be an adult who's the first time presentation for behavioral health in some unit of the hospital other than inpatient. It could be from a housing provider that the referral is coming. So we're gonna, you know, if it's not this program, then hospitals have said, then what? And that's one of the things we look to cover coming up next. Next slide. Katie Brown is going to talk through our conversations with hospitals to re-engage face-to-face, because early in the COVID pandemic in March, basically hospitals said, outreach workers, as much as we love partnering with you, please don't come. We have to reduce the amount of people who are entering the hospital. And because with the amount of experience that has been gained around managing contact at a hospital setting, we are beginning to reintroduce some face-to-face contacts. So Katie will talk through that.
Great, thank you. So as Sally said, we have been having conversations with the hospital systems individually, and so I'm just going to walk through the actual process of making an outreach. For people to know now, every outreach, no matter what is going on with them, if they're eligible for a program, we can at a minimum provide telephonic outreach services, but we have been working on trying to look at more virtual options along with in-person face-to-face. So many people know the initial process of being able to call the referral line. There's a centralized line for HCL inpatient, adult ERE, and youth ERE, and then Epic has its own individual line that are both listed here. So once you call that number, a BHR worker will answer. They're able to answer 24 hours a day and 7 days a week, and they will answer and determine eligibility for which program, and then they will contact the outreach staff to follow up with you all. When the outreach staff is contacted, they're provided with information to get in contact with the person who made the referral, and they will talk to that individual about, one, is this an actual approved face-to-face location? So not every location or entity within the hospitals are currently approved for workers to come back. They will consult with that referrer about the best options for being able to meet with the individual. So in some cases, it might be a very appropriate referral that would need a face-to-face option. And if you are at an approved hospital, that's an option that can now be provided. In other cases, it might be beneficial to look at doing a virtual or video option. And some hospitals have been open and willing to expanding those options. And if you are one of those hospitals and we have not had that conversation yet, I am more than willing to start having that conversation with you all. So being able to set up a video call, or we can also always do a telephone call immediately after the referral, pretty much as soon as the person contacts you. So the hospital staff will speak with the patient and they'll set up the telephone calls or the WebEx, or they will expect to have the outreach worker there for face-to-face. Next slide. John. So if they are appropriate for face-to-face, the outreach staff will usually respond to the hospital site within an hour. There might be some exceptions to this, but they always will talk with the referrer about when the best times are to come onto the unit to be able to meet face-to-face. The outreach staff are screened by hospital staff upon arrival, and all the outreach staff are aware of this. The outreach staff have all been provided with their own masks to be able to wear at the hospitals whenever they're present. And so then once they are screened and the hospital has said that they can come in, the staff will inform the hospital what program they're with. They will notify them of the staff person that has made the referral, and then that hospital staff person is able to help connect them to the client so that way an outreach can be completed in person. So that is basically where we're kind of at with being able to set up some more face-to-face options, but we are also still very much able to do virtual and telephone options when those are also appropriate, or when you might be at a site or in a department that's not yet approved. So please continue to refer.
So we are trying to cover a lot of ground in a short amount of time. So if you have questions, would you please type them into the chat, and we will make sure that we attend to some questions and answers at the end. And one of the things that I also sent to anyone I knew who was coming to this webinar is a chart that a lot of the managers have worked on that describes the agency's targeted service area, what payer sources they accept, if it's mental health or mental health and substance use, and the phone number to call and what to expect when you call. So, and what documentation that a prospective, an applying client would need to have on hand. So that handout was emailed to you, and you will receive it as well. Now we're going to have several people talk about the following, respond to the following 3 questions at their agency. How to access virtual or face-to-face intake services at their agency, including special access points for hospital referrals. And how can you, the referrer, consider if a patient would likely be eligible for the provider's services. And again, if it's the HCL services, you call the centralized number, and BHR, Behavioral Health Responses call center, and the worker who receives that referral will aim to sort that out. But if you're calling for a patient that doesn't meet those special criteria for those outreach efforts, and you're just trying to discern, should I call agency X, what might you need to consider, and then a little bit of what services are provided. We've asked each presenter to do 2 slides and keep it to 3 minutes, so it's an awful lot, but here we go. So I think our first are these 3 folks: Ashley Murray from Gateway Foundation, then Veronica Durdello from Preferred Family Healthcare, and Amber Simpson from Queen of Peace. So Ashley, are you unmuted?
Can you hear me?
Yes.
I'm sorry, I still had my computer screen muted, and I apologize. Thank you for having me on, but I apologize for not being in person, well, on the camera, but the computer I'm currently working on, the camera is not working, so I'm only on the phone. So I am with Gateway Foundation, and we are an adult substance use program, primary SUD services. However, we also do see co-occurring and trauma clients. We are an outpatient and an intensive outpatient program providing levels 1, 2, and 3. With COVID, we've changed a lot of the things that we're doing as far as screening individuals when they come. I put a picture up here of just basically the front office because we completely eliminated our waiting room. And when an individual comes in, they will be given a mask, hand sanitizer. They will be screened with not lengthy, but a detailed screener talking about COVID-related symptoms and their history and travel experience, and then we will take their temperature. At that point, they will get a sticker and they will move forward to the next level, which is going to be able to see the providers and the treatment team. Right now, we are kind of doing a hybrid where we are doing in-person and virtual services. And for our community-based program, we are able to see clients next day. So in order to refer, we work with Epic a lot, and the coaches basically give us the background information, and that is kind of done as a screening. but we would just ask that you call myself or the counselor supervisor over the program, Bridget. It's on the next slide. And we'd be able to kind of do a screening over the phone and then get the client set up. We are doing in-person assessments, but we are also able to do them virtually via camera or telephone if it is better for the situation. We are doing individual sessions. We are back in person doing groups. However, it's the maximum amount of clients that we can have in those is 9 people due to social distancing standards. And let me see what I'm missing. We have medication-assisted treatment. We actually share a building with ARCA downstairs, so our clients come to us, get a referral, and then go downstairs and see ARCA for their MAT services. We have individual group case management, employment services, co-occurring counseling, and peer support services. Let me see if there's anything I'm missing. I think that's primarily it. Can you go to the next slide? Okay, so we do see both males and females, 18 years and older. They have to have a primary substance use disorder. And we serve uninsured or those have no other resources to pay for treatment. We do service people in both in and out of the justice system, and we are a C-STAR and SOAR program. So there's my contact information or Bridget, and if you contact us, then we can get an individual scheduled the next day for an intake. That's pretty much it.
That's great. Thank you. And I forgot to say that Katie Brown, my coworker, volunteered to do timing, so she'll message you in the chat box as you're approaching your time limit. So thank you for accepting this invitation to be concise. So from Preferred. Ready, Preferred? Do you want to go through a couple slides and then do Queen of Peace?
Hi, thank you. Thanks for having me, and thanks for having this. I think this is going to be a lot of great info. But hi, so I'm Amber Simpson. I'm the clinical director here at Queen of Peace Center. Similar to the last speaker, our services are pretty similar to how they were in the past in terms of what we offer. However, they do look a little different in terms of capacity and the way individuals might need to navigate services when they first enroll. But our services can, particularly for enrollments, individuals can go on our virtual doxy.me, and I believe I do have that on one of the slides, that a client can enroll in services beginning at 9 a.m. and then we take our last at 3, Monday through Friday, and so that can be done virtually. If the individual would prefer to come in, we still take walk-ins. So walk-ins begin at 9 and end at 3. That is still at our location, 325 North Newstead, which is in the Central West End. The individuals will have to wait outside until our nurse or medical coordinator can come down and do the COVID screening and take temperatures, and then they will be walked upstairs to begin our enrollment process. We still continue to do same-day MAT. When individuals are enrolled in our services, they'll still have direct access to their counselor and their community support worker. We do still provide home visits. However, again, they look a little different in terms of usually the clinicians will meet with the client outside of their home on the porch, making sure everyone is masked and keeping that physical distance. We do still have residential treatment services going on. Individuals are required to, the day that they come into residential treatments, they do have to show proof of COVID testing that same day. And they do need to stay in their room until we receive those COVID testing results. There still is treatment for them. We can provide them with an iPad for our groups. And then they still have individual sessions virtually again until those test results come back. But we still have our C-STAR programming levels 1, 2, and 3. We do provide virtual groups for our clients. Yeah, and I believe my contact information is in there, as well as our intake manager. So you can make referrals by emailing those two, or yes, by emailing Marlena Holmes, and her email address is down there. And then you can always call, but because it is walk-in, you can always feel free to just have the client walk in. I think.
Yeah, if, Amber, could you just, there was a question in the chat saying, do you do the COVID testing there on site?
We don't yet. We are trying to coordinate that, but we have had Affinia come here to host the testing. But we do not, as of right now, do the testing here. We are hoping to fairly soon, but not yet.
Got it. Okay. John, would you back up just a second to preferreds 2 slides? I don't want to leave them out. Their manager, Veronica Dordello, got pulled away to attend to something. But here's the information they have prepared to share with you. They're one of our primary partners in substance use provision. And that's a picture of their Donica site, which is only a few years old. It is beautiful. And they have 5-day maximum medical improvement, MMI detox. They have residential treatment in St. Charles, Jefferson City, and Kirksville, and intensive outpatient programs levels 1, 2, and 3, as well as therapy, trauma, SUD counseling, community support services, peer services. They do medication-assisted treatment, individual placement and support. Next slide. And there are the phone numbers to call. So if you are going directly to them, there's kind of the lowdown. And they're doing very similar COVID response procedures as you just heard from Gateway and Queen, where testing, use of masks, invitation to participate in video intake, or people can come into the site and do a video take on their property. So it's a good array. Jeff from ADAPT, would you be willing to share?
Hi, I'm Jeff from ADAPT. A little bit about our services. We are a community mental health provider. We work with adults with chronic mental illness. We do community support. That's anything therapeutic. I like to say that it's a jack of all trades. We do a little bit of everything. We connect our clients to services. Some big things we start with is we help our people find and see doctors, psych and medical both. We help them with their medications, getting them from the pharmacy, understanding them, making sure they're taking them correctly. We often go into doctor sessions with our clients, making sure that things are communicated and everything's understood. Excuse me. We also help with housing. We don't have funding of our own or apartments of our own like some places, but we help our clients find it. And we also have a new team for dual diagnosed clients. Their primary diagnosis still has to be a mental health issue, but it is for people with dual diagnosed with a substance abuse issue. And, excuse me, So some of our criteria. Oh, and we see clients in the community. We are not we can transport people, but we are not a transportation service. We transport people for medically necessary things that they cannot do on their own. So that's seeing the doctor, getting their meds from the pharmacy, things like that. And if we could go on to the next slide. So how to access us, our criteria. You have to be at least 18. We can't work with kids. You have to live anywhere in St. Louis City or County. And you have to have a mental health diagnosis. We can and do diagnose in-house, but there obviously has to be something there. It is mostly what we used to call Axis 1 disorders, schizophrenia, bipolar, major depression, PTSD, and some personality disorders. Developmental disabilities are not a qualifying diagnosis for us, but we definitely have dual diagnosed people. And we prefer our clients have Medicaid. To access our services, you call the intake line and have a conversation with our intake coordinator, Caroline. Her contact info is there, her general number. And we have to speak to, we like to speak directly to the client at the time of the referral. It's about a 10 or 20-minute phone call, and we cover the big things: mental health issues, if they have doctors, physical health, substance use, suicidal ideation. But definitely more information from the referring source is always helpful. Diagnosis, meds, health issues, anything like that. We are admitting currently. I'm always afraid to say that because it can change on a day-by-day or even minute-by-minute basis. And we admit by priority, not first come, first serve. If somebody presents with high needs, we can get them in within about a week or two, ideally. Somebody with lower needs might hang around on the wait list a little longer. And I think that's my time.
Thank you. Kanisha.
Hi, how's everybody doing?
Good, good.
I'm the case manager here at Provident Behavioral Health. Couple of things that we provide. We are, first off, we are doing only virtual appointments right now. We provide both psychiatric and counseling services for our clients who work both with children and adults. So we are currently open for intakes. We are doing those over Zoom. We have suicide prevention crisis lines where people can call in. We have a couple of different lines that we're answering right now. Feeling kind of blue, a couple of different things. And I didn't put in our slide. Our intake number is 314-533-8200. And then you can schedule with one of our nurse practitioners for a psychiatric evaluation. And then you can also call that line as well to get in to see our therapist. We take insurance. During the intake process, we try to establish what type of insurance we take. We take various insurances. Like I said, we're doing virtual appointments. We have really great staff. So if you want to pick a therapist, you can go to our website and take a look at who we are employing and kind of pick your therapist from there. We have, like I said, our crisis lines, Lifeline, Feeling Kind of Blue, and then just our normal crisis lines as well. I think that's kind of what I had.
That is great. And really keep using your chat if you have questions, because if there are basic things like the COVID question, we can definitely get those in. And otherwise we'll carry on.
Oh, and I did just see a question real quick. Do we take no insurance? We do. We take self-pay as well.
Okay, great. Susan, do you want to go and tell us about Independent Center?
So I don't know how many people have heard of Independent Center. We've been around since, I think, 1981. Our primary services, we do community support. We have psychiatry and counseling services, and that is individual and group counseling. We just started an ITCD program, so that's getting up and running. The folks we serve is serious and persistent mental illness, or SMI. We serve St. Louis City and County, 18 years of age or older. We ask that people call our intake line. We prefer to talk to the individual who's going to be receiving services. Our welcome center is not open currently. I'm going to talk a little bit about the clubhouse because that's probably most confusing for people who have not been exposed to it. It is our day program. It's based on a work day, and individuals come in and participate in the work day. We also help with employment goals, wellness goals, education goals. We have the opportunity to support people with scholarships who are going back to school. We have several ways that we help people with employment. Currently, we're not offering tours of the clubhouse, so I have the website address here. There's some really nice videos, so if you're talking to someone who might be interested, there's some really nice videos, and there's description of all the programs that we offer. The other thing I wanted to show, and if you could go to the next slide, please. This is just an example. The clubhouse kind of had to step back and go to a virtual work order day. So they've been offering a lot of Zoom groups for our members. We want our members to still stay connected to a community. So we offer everything from wellness, they'll do a yoga class, to spirituality. We have regular unit meetings so people can catch up and see how everybody's doing, dual diagnosis, and then they're planning more evening, weekend, holiday events. The clubhouse is starting to reopen. They're in phase 1 of reopening, so there's a limited number of people attending, but I expect that number will start to increase, and then more members will be attending during the week.
That's great. Susan, if you can touch on this and anyone who's already spoken, but there was a question in the chat for the centers who are still primarily virtual. What are, when do you anticipate being open to more face-to-face? And my sense is everybody's doing some level of face-to-face, except what Provident just shared for their services. And it's how much is being phased in. If I got that right, if you could share a little bit more of any of your phase-in plans, because as we've been, especially for the hospital community linkages initiatives, we share the understanding that the hospitals, that a lot of the patients are struggling to access virtual care, and if they are not connecting, then it's very challenging to have them be stabilized. And I also know from the community provider side is that they're operating on some extraordinarily tight budgets. Many have had to do furloughs. It has been extraordinarily challenging to continue, and the hospitals have done furloughs as well. So trying to be as responsive to high need clients as humanly possible and balance what is the capacity of the agency is a fine line to walk. So I appreciate the question, and if folks could talk about phase-in back to face-to-face challenges either in the chat or in those coming next, what they want to share. Susan, anything else you want to say before?
No, but to answer your question, somebody had asked the hours, 8:30 to 4:30, Monday through Friday, are the times that, now we don't have somebody answering live, so we do get back to folks as soon as we can. We schedule assessments for folks who are going to be in community support right away. And they're, depending on if somebody wants to come live into Clubhouse, there might be a little delay with that. For new folks, community support, ERE, HCL are all still doing face-to-face. So as soon as somebody's released from the hospital, I think Rhonda's picking some folks up and actually engaging them in services upon discharge. So I hope that answers everybody's questions.
Yeah, it's good. It's good. Thanks. All right, Jenny, you want to tell us about NCADA's what you had wanted to share.
Sure. So NCADA, we're a little different than some of the agencies that have shared already, in that we are more of a prevention and education organization. We do not offer treatment services or ongoing mental health care. So our list of services are on the screen. I don't think I need to read those to everyone, but just to hit on a few that are probably most relevant for this conversation, and then I'll also review some of our COVID procedures that we're currently using. So we, like I said, we are not particularly a treatment agency, but we do offer assessment and referral and information to people. And so when somebody might be struggling with substance use, they can call our agency and we can help connect them with appropriate services or the right places. A lot of times people aren't even sure of a number to call or kind of what direction to go next. And so we can kind of help make that referral or provide that information. If even via phone call, that initial phone, somebody still just is really not sure what to do, we can offer a more in-depth assessment process where then we can kind of take a look at what their needs are and help make the appropriate referral. These services are available for adults and adolescents. Adolescents, all of our services are available at no cost to the client. Adult assessments, we do have a requested charge of $25, but we do have funding resources that if $25 is a barrier for any individual, we are able to offset those costs. We are not insurance-based, so we do not take any insurance, so either it's zero cost or up to $25 for the services. We do have our transitional counseling program, which is an early intervention program for adolescents, which is a little more in depth than just an assessment and referral. And this is more for a young person who has experimented with substance use, but might not meet criteria for substance use disorder, but needs a little more ongoing education and support, depending on what their situation is. And through our partnership with MIMH and DMH and the MOHOPE program, we're able to offer overdose education and naloxone distribution, both at other agency or organization level and individually based. So if somebody is at risk of witnessing or experiencing an overdose, we're able to help provide them resources that way. As far as our services right now, and if you want to go ahead, you can flip to the next slide, I think. The best way to access our services is just to call our main number. During COVID, we are currently still not offering any face-to-face services. All of our services are still being held virtual only. We continue to assess public health requirements and COVID rates, and we are making changes and decisions on when we will start face-to-face on a daily, if not weekly basis. So I don't have a date when we'll be doing face-to-face. We are just not sure yet. But we do have staff staggered both in the office and working remotely. So if you call our main number, we will be able to connect with people and either offer them phone services or other telehealth services. We also have email options and other virtual ways that we can connect with people if that works for them. I think I covered it all. If there's any questions, I can take them. Otherwise, that's all I have.
Thanks. Thank you very much. And keep using the chat. We're capturing those and we'll make sure we touch on them all. There's some rich information in there. Shannon, would you tell us about BJC?
Absolutely. So BJC Behavioral Health right now, we are primarily in a virtual format, but you can access and we're open for all of our services just like normal. And so you can contact our call center, which I included that number on our slide here. But we provide case management for individuals with a treatment history of a severe mental illness. We have therapy for really anybody. No diagnosis is required, but they can't have insurance at this time. We have psychiatry and residential services, but inside of our programming, when you are a client, you really can access a variety of things. So we have peer support specialists. We're doing groups through Zoom. We have our ACT-A programming. We help to connect with community providers. We have pharmacy in-house, and we also have medication-assisted treatment for individuals who are struggling with substance use. So for our criteria, we can see anyone of any age from 2.5 on up. Our service area is in St. Louis County and parts of the city. And then we also have a region down there in Southeast Missouri. And like I said at the start, really anyone can contact us at our call center. We have staff there between the hours of 8 and 5. They're able to complete kind of brief screenings and get individuals scheduled for intake, and sometimes even get them transferred over to an intake specialist in the moment so that they can start their process right away. And so I think for COVID, we're getting ready to roll out more face-to-face procedures. I don't have an estimate on when that's happening. I know it is soon. We're kind of starting to talk through what sounds safe and sounds appropriate. So primarily, the best way to get in touch with us is through that main call center line. But for anyone who does come in face-to-face, for example, for emergencies or for any of our current clients getting injections or seeing a doctor, we do have screeners at the front of all of our office locations so that they're able to ensure the safety of everyone, and including wearing masks at every facility. And I think our next slide just kind of shows where our offices are. And we went ahead and starred the ones that are primarily doing everything virtually. Our downtown location and our North County location, and then our Farmington location, all have individuals who are at the offices and available to support in emergencies. And hopefully, as time progresses, we'll be able to have a little more face-to-face interaction and in the community.
Okay. Thank you very much. I think we're going to go back and make sure that preferred family healthcare information is covered more with from an expert who is there, rather than just sharing the slides that I did. So Veronica Duradello had some technical difficulties, but she's with us now. Veronica, I
Hi.
the slides, so just talk them through what you want them to know.
All right, great. So kind of in a nutshell, we provide adult substance use services at the Donegal location, specifically where I work. However, we do have also adolescent services. There are South County, North County, and our Northrop residential services, so for adolescents as well. We have 5-day medically monitored detox with 18 state-funded or private insurance. That is not a prerequisite to coming in, 18 detox beds at our Donegal location. And then we have residential treatment, which is up to 20 or so days in St. Charles, Jefferson City, Kirksville, and I think Trenton, Missouri. We provide intensive outpatient programming, levels 1, meaning day treatment, so 8 to 4, level 2 and 3 kind of as needed services, along with mental health services, therapy, trauma work, community support services, so case management, and we also have peer specialists, peer support specialists. So we have a full MAT clinic at several of our sites, especially more specifically Donegal. We provide a lot of services for the EPIC program you might be familiar with, which is the hospital outreach. When a client or a person in the community has either overdosed or has identified through one of the hospitals that they are an opiate user, they are streamlined to us the next day. They come in, they see a provider same day and receive MAT should they want it, a biopsychosocial assessment, and they are enrolled in our program, in our services right away. So it is individualized treatment. There is no cost unless, of course, your income is like something like more than, I think, $70,000 a year, and then that would be income-based. Otherwise, the residency requirements would be Missouri resident. However, we do have folks who come through who are like, they're homeless. So if they're homeless, then, we would allow them to come in as well. No insurance, like I said. They would need a substance use disorder diagnosis to be eligible for our services, and a mental health diagnosis, and not necessary, but often happens alongside the SUD diagnosis. Those are the phone numbers for contact. There's kind of the hub is in, our access team is located in St. Charles, but we are pretty efficient with trying to get folks scheduled. So that's the phone number for outpatient services for Donica, also the pfh.org website if you need specific information about any of the other sites in the St. Louis or the Eastern region.
Great. And one of the questions that had been in the chat was about any understanding of phasing of the components of your service array that are primarily virtual, and when you might be able to shift any more to face-to-face. You spoke to that quite a bit. Anything you want to add in that realm?
For folks who don't have phones, who can't engage in groups, we are doing, you know, our outpatient groups over the phone. We are allowing people to come in and use an office and use one of our phones to engage. We were doing some day treatment. We're not doing groups in person now. It's kind of as needed. If folks really need to come in individually, we'll definitely let that happen. And if they need, for their providers, their MAT appointments are still coming in for those appointments and seeing a provider via telehealth.
Great.
Yeah.
Great. All right. Veronica, thank you so much.
Thank you.
Yeah. I think we're on slide 29, John. Thank you for facilitating. And we have Lauren Bruce.
Hi, I'm Lauren Bruce. I'm the Director of Access and Urgent Care Services with Compass. A little bit about Compass right now. So services we do provide are outpatient psychiatry and therapy for adults and youth. We also have CPRC programs for both adults and youth, and then a variety of other programs not related to mental health, but that closely coordinate with our mental health programs. Primary care, dental, pediatrics. We also have an express care clinic. We cover St. Charles, Lincoln, Warren, and Franklin counties out in the eastern region, and then we're spread across the state and other additional counties. Our current process for open access in the COVID times is we're still running our open access. We're striving for same day enrollment. Now that enrollment can be done over the phone or over a virtual platform, or a person can present at our office and they'll be greeted, they'll have a temperature check, be given a mask, and then they'll be put in a private office space to wait until a clinician is available that will provide that service, that enrollment over, or the assessment rather, via telehealth. So we realize that there's barriers with technology and things like that, so our offices are still open to serve people. We recommend that someone call our central scheduling line if they're going to do it. Even if they're going to come to the office, they can start that paperwork process and they won't have to wait in the car as long. Let me see what else we got going on. If we go to the next slide, please. So anyone that's a potential client will have a mental health assessment completed by a clinician. If you present at the office, like I said, you'll have that virtual assessment done over telehealth with a clinician, and you'll be in a private office space. You may meet with our front desk staff to complete some of the auxiliary paperwork and things like that while maintaining social distance. If you do all of it over the phone or virtual, you'll start with our central scheduling service. They will begin that process over the phone, and then again, they're seeking to have either transfer you to a direct appointment to complete enrollment. They'll schedule an appointment later that day, or they can schedule it next day. So for folks coming off the unit, you know, they don't have to schedule an appointment, but it might be helpful to start that enrollment process while they're on the unit. And then when they get out, they just know they're going to meet with a clinician either over the phone or at our office to complete that enrollment process. We accept Medicaid, private insurance, and then for the uninsured folks, we have a sliding scale fee available that's based off of income. So when they present for an open access appointment, they'd want any insurance card they have, an ID, bank statements, pay stub if they're uninsured. Our folks that help coordinate that provide, let folks know exactly what they need to bring for open access. And during that assessment, they'll be assessed and recommended for services, whether it's psychiatry, therapy, case management, or something of the like, or SUD. And with that, we try and, if someone's seeking just psych only, we try and pair that service with another service. Additionally, our psychiatrists can't prescribe benzos, and we typically try to avoid scheduling people for just psych only. if people have that first appointment for the mental health assessment, they will not be seeing a psychiatrist that day. They will be being assessed for services. With regards to Sally's question, in terms of the rest of our agency kind of getting out into the world, I think my biggest suggestion is that while the majority of our services are being provided via the phone or telehealth for case management and things like that, if you have a specific concern about a consumer, please reach out to that person's treatment team, and they have the ability to kind of go out into the world and help support that person in real time and live in person. So while following CDC guidelines and protocols, and more of those things are happening. We don't have a set target date for snapping back to normal, so we're just kind of rolling with it. But if you have specific needs, the biggest suggestion would be to reach out to that person's treatment team and try and help advocate for that clinician and go out and see that person face to face. So.
Lauren, I love that you said that, because my sense is that that's the general truth from all the community providers, is that they've put in place guidelines to support virtual and remote services where they can, and where that is clearly not enough. Those are the first populations that they're turning to and have been turning to in the last month or so to resume face-to-face and put on the PPE and go out. So it's not that all services are virtual, it's just they're triaging it back towards face-to-face.
Yes.
Did I say that accurately?
Yeah, and it's not a hard and fast rule. It's a very gray area. So if there's a need, I know that our community-based services are for sure trying to find ways to see people out in the world, so that everyone remains safe. And I think that while it's hot out, it's a good blessing right now that it is hot out. So
that is great. And just kind of being sensitive to some of our audience or hospital providers where they have maintained their inpatient psych units and their ERs open based on other mandates and other funding sources. And they rely heavily on stabilizing a patient and getting them linked to ongoing care so that they can remain being the acute services. So we're completely a partnership, the hospitals and the community providers together in supporting the most vulnerable patients. And I get it, the hospitals feel like it's the partnership is strained.
Just to add, I know I'm probably throwing my staff out here, but if you guys do run across any Compass clients that you're having difficulty identifying who that treatment team member might be, feel free to utilize our HCL, ERE, or Youth ERE staff that can easily look that thing up in the medical record and get that contact information over to you. They'd be more than happy, I know, to help coordinate that for you if you guys do have challenges. So just reach out to those folks if you need that.
I feel at liberty to say that's true for each of the agencies, so thanks. Okay, Amy, do you want to tell us about COMTREA?
Yes, I'm Amy Phillips. I'm the Vice President of our Adult Behavioral Health Services. So I have just the one slide here that just identifies just the variety of services that we do have for mental health and substance use. So we are the primary community mental health center for Jefferson County, so we cover a pretty big area. We are a community health center, so we also have dental and primary care services. I focused on the behavioral health services here. As far as access, much like everyone else is saying, it looks a lot different right now than it did pre-COVID. As of right now, all of the services are being accessed via our Welcome Center over the phone or via telehealth. So that's why there's two numbers listed on the slide. So for right now, folks are calling the 636 phone number to get directly to our Welcome Center, and they assist with getting the information over the phone from the individual and getting them scheduled for their assessment to kind of figure out what services they are needing from us. The second number that is on there is actually our central admissions number. I know at some point, much like everyone else, we're evaluating and moving towards some face-to-face services. So if anything has changed, Central Admissions has that information. If people are wanting to kind of check back in and see if our open access is open. Pre-COVID, we had our Welcome Center and it was open access. So people would walk in, there was a screening that would determine if they were considered urgent or routine, and we would kind of triage from there as far as when they got scheduled. So as of right now, if you have any individual who's in need of our mental health services, some of our biggest services are the community support services out in the community, as well as our case management that is office-based. So that provides a lot of care coordination. We also offer individual therapy services for mental health as well as substance use. As far as eligibility, really we are open to all. What program it is would depend on diagnoses is a big piece. I know somebody else had mentioned serious and persistent mental illness. So those with SMI a lot of times are going to be the ones that end up qualifying and being a part of our DMH programs, so our CPRC or CSTAR. But we also have individuals who are seen just under their insurance for psychiatry services or counseling. And then we also have sliding fee options for those who don't have insurance but maybe don't qualify for the DMH funded programs. I think those are the primary things. Like I said, I think as far as virtual versus face-to-face, as of right now, most of our services are virtual, so phone or telehealth. We are moving into August, kind of triaging those who either don't have access to the virtual options or who are not doing well with the virtual options. So those who really have that medical necessity to be seen in person, that we're going to start working to see those individuals face-to-face while using all recommended precautions, the face mask, social distancing. But again, very much triage and getting those who need the face-to-face in front of someone, but continuing telehealth for those that it's working well for. I think that's everything.
And just to point out, we just heard from COMTREA and COMPASS, and that they are a federally qualified health center and a community mental health center. And so there are an array of services in one auspices, and Hopewell, who we'll hear from in a minute, has an affiliation with the health center. So that's why that array sometimes looks broad, because of their health center component of services. Did I, Amy, did I capture that accurately?
Yes, ma'am.
Okay, great. Okay, well then let's, I do want to reassure folks, getting some questions asking about access to the slides. There's a slide deck and 2 handouts that we can get to anyone who was originally sent an email inviting you to this presentation. If you did not get that Outlook calendar request, would you drop your email in the chat and we'll scoop up your email and make sure you get them as well. But if you received an email from me today saying, hey, reminder, here's 2 handouts, then we will make sure you get this slide deck and the web link to the recording. So drop your email in there if you did not receive something from me this morning. Okay, Ashley, will you please tell us about places?
Sure. Hi, everyone. I'm Ashley Mooring. I'm the program manager for our Welcome Center, which is our intake and outreach teams. Places for People is a mental health center similar to what you've heard from previous agencies. We serve St. Louis City and County. We don't have any particular zip codes that we work within that or any catchment areas. So as long as clients are within those 2 counties, we will serve them. We serve individuals across the lifespan, so children, families, youth, and then adults. We have 3 primary programs that we work within. Our rehabilitation services, so those are our community support teams, case management. We also have assertive community treatment, which is our highest level of care, and those teams serve folks that have the severe mental illness, but then they also have extenuating psychosocial factors. So they're often homeless or have high contacts with hospital or law enforcement. And those teams see our clients several times a week. So it is a much higher level of care than our traditional case management. We also have ITCD teams, which are for co-occurring disorders, substance use diagnosis, as well as a mental health diagnosis. Outside of our rehabilitation services, we have an outpatient substance use treatment program, which Places for People isn't necessarily known for. We're known for our behavioral health or mental health services, but this is a program that serves folks with primary SUD diagnoses, and it's very similar to the C-STAR level 2 and level 3. So they're going to offer individual and group substance use treatment. We also have an outpatient mental health clinic, which offers therapy and psychiatry. We do offer psychiatry only for folks in the community, as well as therapy only. So in terms of access and criteria, so our rehabilitation services, again, presence of the severe mental illness. They can also have a substance use disorder. They have significant impairment, so they're going to need that case management support. All of our intakes for all of our programs are being conducted over the phone or virtually right now. And the best way to access our rehab services is to call our Welcome Center, and the phone number is up there on the screen. What people will get is an initial screening where we just assess for, what their mental health concerns are, substance use concerns, any other factors that are going on in their life right now. And we then schedule them for an intake based on their acuity level. The Welcome Center is a great place to call if you don't know what program they're eligible for too. It can be a one-stop shop. We answer the phone in the Welcome Center right now between the hours of 9 and 2. We are not having any clients come to our facility right now. We're on Lindell. And so all of our walk-ins, so to speak, are done virtually or over the phone through that number. I would say if you have somebody in the hospital or in substance use treatment that you want to refer to do that initial screening, it's great for them to do it while in the hospital. We do have to talk to the client personally to do the screening, but it's great to get that started while they're there, and then we can schedule their assessment. Our outpatient services, so both our SUD treatment and our outpatient therapy and psychiatry, are doing their intakes virtually as well, but you can contact those programs directly and they'll get you scheduled right away. So it kind of takes out the middleman of the Welcome Center, and those numbers are on there as well. Even though we're not accepting people or clients to our facility, we are providing a hybrid of virtual services as well as face-to-face. So for community support, people are, our case managers are going out into the community. For those folks that we really do need to lay eyes on and see face-to-face, we are doing injections out in the community. Obviously, can't do those virtually. And so it really just depends on the client's needs, and that's very individualized. Most of our outpatient services are done virtually right now, therapy and psychiatry, and then our substance use groups are done virtually right now as well. It's hard to know when we will start to phase back in face-to-face visits in a more robust way or at our facility, but we, like Sally said earlier, we're really doing our best to meet the client where they need to be met, and if those face-to-face services are needed, then that's what we're doing. So I think that's it. And we do take all forms of Medicaid, Medicare. Our outpatient clinic does take some forms of private insurance, and we do take uninsured folks.
Sounds great. And we've got one more presenter, but please keep your questions rolling, and then we'll spend the last bit of our time trying to do some dialogue to address those. Okay, we've got Blake. Please share.
Oh, good afternoon, everybody. So I'm just going to talk about HOPEWELL services and specifically the adult services. I didn't have all the information I needed for the children's services, but I do know Claudine Allen, who is the Children's Services Manager, is on the line if you wanted to have her speak as well. HOPEWELL is the administrative agent for North St. Louis City. And so very specifically, we serve a group of zip codes, and those are noted down at the bottom of that first page. And primarily, we are providing at the adult side, psychiatry, individual therapy. We provide community support services. At our Gateway building, we have our psychosocial rehab program and the assertive community treatment for transition age youth. In addition to PHASES, which is our substance use program. Right now, at the adult building, we are not seeing really anyone in person. Everything with regards to psychiatry and individual therapy is via telehealth. If we are having some folks come down who maybe need injections and need some nursing services, things like that. And those individuals are screened at the front door, given masks, sort of thing, before they receive the services. We don't have a plan right now for when we might resume in person. We're just taking a very slow approach. Actually, for many of our clients, this opportunity to do telehealth has provided or has removed some of the barriers to services that many of our clients have, especially with regards to transportation. As stated, we don't have a specific plan for when we would resume opening back up. Our community support workers and all do go out into the community on a very kind of subjective basis with regards to clients' needs and the availability of PPE and that sort of thing, are seeing clients in the community, transporting as needed. But again, that's kind of on a case-by-case basis. So you can go to the next slide there. So the best way to access either adult or children's services is to call that number there, 314-531-1770. And then you'll be met with a phone tree that with a number of extensions for either adult or children's services. Eligibility for our services, largely, like I said, it's going to be bound to our catchment area. But we do have provisions for serving people outside of that catchment area. And of course, many of the folks that we are providing treatment to may be unhoused and might be moving around. So we do our best to see anybody and everybody who is referred to us. That's all I got.
That's great. So Katie, John, can you help in monitoring the questions? I think we had something for Provident around access to their Mary facility. Kamasha, you want to say a word about that? Then we can go backwards. I think she said it was folks over 55 to the Mary Ryder Homes admission requires that women be 55 or older, low income, and able to make an unassisted pathway to safety exit in the event of an emergency. The admissions are case by case. Any other, and of course, I think all the providers would prefer to work with Medicaid eligible clients because it's a payer source. Working with the uninsured, just as, you know, the hospitals, comes out of their charity care, working with uninsured comes out of providers, Department of Mental Health contracts, which they can make go further if they are also billing Medicaid. So what other questions or concerns? I do know the agencies are striving to get back to more face-to-face services. We don't, you know, and I do know that hospital providers are desperately eager to have them as partners in that level of care and service. Other questions, or anybody who got to share about their services that say, oh, I wish I had shared something and didn't? Well, and many of the providers also do take private insurance, not all, but again, that's, you know, folks aim to accommodate those with a payer source, and it's the uninsured where it's a struggle. But, you know, everybody has a mandate to take some number of them. All right. Well, how these conversations are continuing. We are continuing efforts towards virtual face-to-face, physical and video strategies in the hospitals. The EPIC manager and some other staff at BHN and I are saying, you know, let's make it more reliable, telephone all the time, video when that's possible, and face-to-face when the patient's need is such that we think that they wouldn't be able to engage otherwise. And as we phase in resuming going face-to-face more regularly. And there have been big pushes to do complex care case staffing. Barnes has a Familiar Faces initiative with people of any need in the hospital. Mercy has been a real champion of, they do weekly complex case staffings and have for the last several months been inviting the ERE regional coordinator, and SSM has a system that is triggered on an as-needed basis, and have expressed that they would include some of the community providers in that partner for collaborative care. So those are some of the initiatives we're pushing on. If we continue to have every other Tuesday meetings that BHN facilitates, where we have CEO and clinical level leadership of most of the agencies that presented, as well as behavioral health hospital leaders. So if you have questions or concerns that you would like to share, please give them to Wendy Orson or me, or to your CEO who participates at that table. And a lot of the community mental health center managers and I are on a weekly call at 3 o'clock to check in around refinements, particularly in this COVID time. So those are some of the tables and forums, and a lot of strategizing keeps happening to try to attend to the most vulnerable folks in our region. I think that's it. Put the contact for Wendy Orson, our CEO, myself, and Melissa Benson, who came down with a very wicked cold and doesn't have a voice. So she stepped out of being with you now. So thank you, thank you, thank you. If I had your email, I will send all these materials, and that's what we have for now. Thank you.